When you have an allergic response, what's happening is your immune system is seeing that pollen or that peanut as something really dangerous. And it's bringing together all those immune cells to go and attack it. And that results in these allergic type symptoms that we expect, like the redness, the itchiness, and that's all released from molecules from your immune cells like histamine.
When the immune system comes across an allergen, basically treats it like something it has to kill as quickly as possible. And when our immune system tries to kill, we'll kill the right agent, but there will also be some collateral damage. Allergens will be cleared and eliminated from the body, but the surrounding cells will also suffer some damage.
My research really tries to look at what's causing these dramatic increases in inflammatory diseases that we have going on all over the world. This work matters because a huge number of people in New Zealand, but also around the world, experience and suffer from these inflammatory diseases, particularly inflammatory bowel disease, where we've seen the rates dramatically increase over the past 30 to 40 years. And it's predicted, for example, in New Zealand, that by 2035, 2040, almost 1% of the population is going to have inflammatory bowel disease. So it's a huge issue. And what we're trying to do is work out how we can strengthen that intestinal barrier to treat both diseases in the gut, but also diseases elsewhere in the body.
So people with fungal-induced allergies tend to have more severe asthma. So our work is really looking at ways in which we can prevent those fungal allergies from happening in the first place. And if they do occur, how can we treat so that people with fungal allergies don't have to have heavy medications all the time?
I researched CAR T cells, which were originally designed to treat cancer as an immune therapy. But because the type of CAR T cells I work with focus on B cells, which are a cell in the immune system that can become cancer, but also a cell in the immune system that can cause autoimmune diseases like lupus and other inflammatory conditions, we can use those same CAR T cells to treat autoimmunity. But we want to do that in a slightly different way, leveraging RNA technology.
We know we had fewer allergies 100 years ago. We have more now. As scientists, we know that this is always the consequence of many factors. One is the genes of the people that live in an environment, but the environment, what's around them, is also important. So we need to understand both.
Philanthropic support is huge for our research. It really means we can do the things we do and can take it to the next level using the most state-of-the-art technology and really push the boundaries.
So when I think about these immune responses, like what's happening in allergy, I think of this sort of domino effect, where you have the first domino which then hits down all the others. And our current treatments are really treating that last domino at the end that's causing that symptom or symptomatic response. And so what we're doing at the Mulligan is we're trying to work back and understand what some of those first dominoes are so we can treat early on and prevent that allergic cascade from happening in the first place.